ARB News. I'm Alex Baglio reporting to you this evening about a new research done by the American Psychological Association regarding mental health in college students. 1 in 3 college students worldwide confirm they have a health disorder. According to research published by the American Psychological Association, students are reporting their symptoms consistent with diagnosable mental health disorders. The reported symptoms include depression, anxiety, suicide, eating disorders, and addiction. Mental health in students is the second most common cause of death among college students. Suicide rates have tripled since the 1950s. Keep watching to learn more about this epidemic and how you can prevent someone from suffering. Stay tuned. 86% of college students have felt overwhelmed. 81% of college students have felt exhausted. 30% of college students have felt too depressed to function. 6.6% of college students have seriously considered suicide. College and university counseling centers presenting concerns. Percentage of students who presented with depression, anxiety, or a relationship problem as their main reason for seeking help at a counseling center. Hi, welcome back to ARB News. I'm Alex Baglio. If you are just tuning in, we have been talking about a research done by the American Psychological Association regarding mental health in college students. It seems that this issue is becoming an epidemic, and we found another research done by Randy Arbark of Columbia University in New York City. Randy did a study that analyzed data collected on nearly 14,000 students in 19 colleges in 8 countries. These countries include Australia, Belgium, Germany, Mexico, Northern Ireland, South Africa, Spain, and the United States. These students were given questionnaires designed to assess their mental health and identify common disorders such as major depression, anxiety, and panic disorders. Randy found that 35% of freshman college students experienced these symptoms. Depression was the most common symptom found by these students. The findings were that 1/3 of students from the countries screened positive for at least one of the 6 mental health disorders. Earlier this week, another study was uncovered and was similar to Randy's. Among more than 67,000 U.S. students surveyed in this study, 20% said that they experienced stressful events in the last year that were strongly associated with mental health problems, including harming themselves, having suicidal thoughts, or attempting suicide. Only about 15 to 20% of college students seek help at their school's counseling centers, and about 40% of students do not seek help. We reached out to Dr. Arbark for further information, but we have not received any comments. Stay tuned for more updates. This graph gives examples of factors causing mental health problems in college students. Stress, 30.3%, anxiety, 21.8%, sleep difficulties, 21%, depression, 13.5%, relationship difficulties, 9.5%, finances, 6.2%, roommate difficulties, 5.6%, alcohol use, 4.1%, physical injury, 2.4%. Welcome back to ARB News. I'm Alex Baglio. As we continue our news report about mental health in college students, we want to give out more information for anyone who is struggling, or if you know someone who is, you can get them help by getting them to counseling so they can start treatment plans right away. If it is more serious, please call the National Suicide Prevention Hotline number, which is 1-800-273-8255. Again, that number is 1-800-273-8255. You can also go on the suicide prevention website, which is www.suicidepreventionlifeline.org. If you do not feel comfortable talking on the phone, that would be a healthier way for you to get help. If you are one of these students or know someone who is, please, we strongly encourage you to seek help so you can start living a healthier, stronger life. Also, please remember that you are never alone. Thank you for joining us on this evening news. I'm Alex Baglio, and Your Life Matters. This is the National Suicide Prevention Lifeline website, where you can learn where crisis centers are around you to get help, or you can get involved in the community. You can call their Lifeline number to speak with somebody to get help, or you can find somewhere to go near you. They explain about the Lifeline and that anyone could be struggling with suicide, and to find more specific resources below. So if you are youth, a disaster survivor, Native Americans, veterans, loss survivors, LGBTQ, attempt survivors, deaf, hard of hearing, and if you speak another language. There's also stories of hope in recovery, and it also explains what happens when you call the Lifeline.